I'm Dr. Graham Craig. It's my great pleasure to introduce two dentists to you, Dr. Judy Fenton and Dr. Robyn Thompson, who have run quite a remarkable practice in Sydney, Australia. What is the current situation with your practice here in Sydney?
Well, look, we're lucky enough to have a very large practice in northwest of Sydney, where we've got 11 practitioners and 13 dental assistants supporting those practitioners. And we've been operational in the current location for about 35 years. And we're open 6 days a week. And we've been very fortunate to have a very large patient base to date.
Dr. Robyn, when did this practice start? If you could just explain how long ago and what happened from the early beginnings.
Certainly, Graham. The practice started in 1979 under the directorship of Dr. Lorna Mitchell, who had been practicing the area for many years in general practice, and she'd always gravitated towards treating children. She'd had empathy with children. But until she embraced the silver fluoride technique, she actually said she did not make any money from dentistry. And she attended a seminar that you presented where she learned about the silver fluoride based techniques, and for her it resonated well, and she made it a business to be educated in these techniques, and from there the practice has flourished.
And you joined her once the practice started to grow?
Yes. She actually sourced both Judy and myself through yourself. She approached you for
my pleasure.
for people who you thought would be suitable for the practice.
Yeah.
And that's where we started. So I joined the practice in beginning of January 1983.
Yeah.
And Judy came in 1985.
Judy, explain to people, how did the practice expand over all these years? How did it expand? And what were some of the factors involved?
Well, there's no real trick. It's totally word of mouth from mothers. They bring their children to us and they watch a very favourable experience.
Yeah.
The children have a very quick, simple treatment with the silver fluoride technique, and those parents who they themselves have been apprehensive, they then gain confidence and then they request to become patients as well.
Yeah.
So the technique itself has definitely spread far and wide because the parents are delighted that we're not using anything that's invasive. We don't need to use local anaesthesia, and there's no need for general anaesthesia. It's quick and simple and can be done in a normal surgery setting.
Yeah, that's and do you get patients that have or parents that have had children that were suggested they have GAs for their treatment, general anaesthetics?
We have many that come in for second opinions because they've been given enormous treatment plans with definitive treatment for a lot of teeth under general anaesthesia, and we're able to do simple treatment and gain confidence of the children so that we treat their deciduous dentition and then they're confident to come back to have their preventative work carried out on their permanent dentition, and they end up being caries-free young adults. So.
And Robyn, so to summarise what Judy's saying, if someone was wanting to get into this area, to distill it down, it seems like that no injections, what's the...
Well, Graham, you've actually hit the nail on the head. It's the fact that we're not using local anaesthetic, and the reason children don't like local anaesthetic is actually twofold. They don't like the injection prick sensation, and they don't like the sensation of numbness. Right. And we've had children who had to have perhaps teeth removed and have required local anaesthetic who've actually not been disturbed by even the relatively pain-free injection mode, but that feeling of numbness, and take it away. And the away is that numbness feeling. So the parents are so relieved that we're going to be using a procedure that doesn't require local anaesthetic, and that was Lorna's biggest factor, I think, for drawing the population. They just wanted the treatment that didn't require local anaesthetic.
Judy, I've heard that the patients come from quite extended areas. I mean, could you amplify this for us? I mean, I believe some of them travel quite remarkable distances to come to see you.
Well, the word does spread, and we have a catchment of basically a radius of about 40 miles within our own state, and we also have patients from around Australia, from places like Melbourne and Brisbane, and we also have patients from the Philippines, Singapore, and even from San Francisco and New York. So, we're often giving advice via internet and so forth, and booking appointments long distance, and in so doing, we even have to liaise with their practitioners over there, such as orthodontists as well, explaining the sort of technique that we've been using with the patients who are delighted to go to the dentist.
Robyn, for those that are new to the area, how do you handle difficult patients? A lot of these have been suggested that they have a general anaesthetic. How do you handle it?
Actually, Graham, you've raised a very good point there too, because I can think of a very recent example, a patient who self-referred to the practice actually, after having a failed treatment attempt with an open carious lesion, a 4-year-old.
Mm-hmm.
She'd been traumatised by the attempt to administer local anaesthetic. It wasn't successful, and the parents were quite distraught. The child was extremely anxious. She was literally hiding in her mother's skirts. We coaxed her into the room. She sat on her mother's knee on the chair. She allowed me with much demonstration to give her a thorough examination, to use a handpiece for fluoride prophylaxis, to discuss the treatment plan. And she came back 2 weeks later, a little bit tentatively, and we used the silver fluoride technique on the open lesions on the lower jaw. And she was a little bit reticent. She came back again, possibly 2 weeks, 10 days later, for the treatment on the upper teeth, and she was far less reticent. She still was sitting on her mother's knee, but she opened her mouth willingly. She came back just last month for a review. This little girl skipped into the waiting room. Her parents threw it from the waiting room into the surgery, chatting to me as she left. Her parents couldn't believe it, and that's what we find. It's time, but the fact that we haven't caused them any pain in any way and explained was perfect for this person, and we've used it time and time again.
And that's, yes, so that's the secret of the...
Exactly.
The secret
exactly.
of the success.
I'll
come on to the economic aspects later, but Judy, you said that adult patients, patients that you've treated when they were young, they don't want to leave you. Is that what's happening?
This is the most amazing thing. I mean, whilst the original instigator of our practice, Dr. Lorna Mitchell, had started a restricted practice for children, it's come full circle now. A lot of the children have now grown up, and they themselves are adults, and they've stayed in the practice, and now they're bringing their own children in, and they're recommending us to their spouses and their other relatives, and a lot of the older patients just don't leave. We don't have an exit age. Basically, you have to have teeth to come in, but the practice now is such that our oldest patients are probably in their 40s, and it's still a preventative practice. We're not doing anything restorative. Most of those patients are basically caries free.
Yes. Robyn, a lot of people, a lot of dentists would be sceptical. Just explain to them how you've made this economically viable, which you obviously have from the results we see today.
Well, absolutely, Graham. Well, the patients, we spend a lot of time in educating the patients in why we're doing what we're doing.
Yeah.
So they understand the silver fluoride-based technique.
Yeah.
They understand its progression to preventive stannous fluoride.
Yeah.
They understand its progression with other materials that we use. So they're on a journey with us. Now, with the silver fluoride technique, 4 quadrants of silver fluoride treatment would equate to a stainless steel crown, about the equivalent cost.
Yeah.
And we have review appointments, and we have routine periodic review appointments, we have additional review appointments. We monitor the teeth, the parents are on board, the children are on board. So it's easy to maintain through, as Judy said, adulthood.
And so they pay, a fee for...
Yes, they do. They pay a fee for review, they pay a fee for their 6-monthly checkup, which our patients maintain, because with this treatment it's important that we treat the permanent teeth at the appropriate time of eruption into the mouth. Yeah,
now, apropos of that, thank you, and this is a point you stress, you target newly erupted permanent teeth. I've heard this through some of my grandchildren and etc.
That's right.
So this is another important part. Can you amplify on that a bit?
Exactly, Graham. When we get a child that becomes less apprehensive to come to the dentist and keeps their regular visits, when they're 4 and 5, and then when they get their first permanent molars, they're very, very happy to have their treatments, their preventative treatments. They're absolutely joyful about coming to the dentist, and so any of those kind of treatments are very forthcoming, and we can maintain them as caries-free individuals.
Yeah, and in terms of without getting into specifics, I believe you use a lot of glass ionomer cement for your pit and fissure sealing in preference to resin, is it?
Yes, well, it's the ease of placement. We've perfected the technique over many, many years, and of course there's the mineral remineralisation that is the component that is a great factor to us.
Now, the other interesting aspect in terms of cost savings for the patient is the orthodontic aspects.
Oh, without a doubt.
Yes. So, what you were saying that some of the ways that you're saving the patients on subsequent orthodontic treatment.
Because as a result of using the silverite technique on the deciduous dentition, we can maintain their deciduous molars for as long as is necessary to hold the space for the successor teeth, rather than having to have, first of all, traumatic extractions under general anaesthesia, and then having the need to go to an orthodontist for space maintenance, which of course is, well, once again, not always well received by patients, but also very expensive for the parents. And here we are once again talking about 4 quadrants of the mouth being less than the cost of a stainless steel crown. Well, you can compare that to the cost of a space maintainer.
Yes. Judy, what advice would you give to dentists that want to actually move into this particular area?
Well, I would embrace the technique, and I would start slowly and do a few small cases and see the results.
Yep, that's right. And Robyn?
Well, I would agree with that, Graham. And as Lorna did, she had been working in general practice, doing conventional restorative dentistry. She learnt about the technique. She heard about the technique. She made it her business to find out more. And when she employed it in the practice, she saw the results, and the results speak for themselves. The practice from 1 practitioner to 11. I think that says it all.
Judy, there's another point that you would like to add.
Well, our philosophy, Robyn's and mine, is really that it's not just the teeth we're treating, it's the child or the individual attached to the teeth. So you're building upon an individual psychologically as well, and I think it's a holistic approach from that point of view.
Excellent. Thank you very much indeed.
Thank you, Graham.
Yeah.
Thank you.